President Obama heads to Capitol Hill this morning to make a personal pitch to convince a majority of Democrats to sign on to health care reform legislation. They need 218 votes to pass it. Meanwhile, Republicans have a plan of their own. Virginia Congressman Cantor is the House Republican whip, and Democratic Congressman Steny Hoyer is the House Majority Leader. Gentlemen, good morning.
Good morning.
Congressman Hoyer, I will begin with you. Both you and Speaker Pelosi have been saying for weeks now that you are close to getting that number, 218 votes. That said, this morning, how close are you in terms of numbers, and will you bring it to a vote this morning?
Well, we're not going to bring it to a vote this morning, but later on this afternoon or early this evening, we expect it to come to a vote. We expect it to have 218 votes. We believe the American people understand that having 47 to 50 million uninsured Americans without health care security is not only good for them, but it's bad for all of us because we're paying more and we have a less healthy nation. So we're going to fight for and have been working for, and every candidate in the last election said they wanted to see a health care reform bill that gave affordable, quality health care to all Americans. That's what this legislation today is about. We think we're going to be successful later today.
All right, Congressman Cantor, Democrats say if there is any postponement of this vote, it will be because of Republican delay tactics. What is the Republican plan today?
Well, I tell you, Amy, I think what's instructive is to look to see where the bipartisanship is surrounding this health care bill. And the bipartisanship is around objecting and opposing the bill that Steny Hoyer is speaking about. I think the question is asking, why is it that maybe 40-some of his members are going to join Republicans in opposing this bill? And I think the answer is there has been a message sent by the voters in this country as recently as this Tuesday. People across this country are extremely concerned about what Washington is doing to them, not for them. This bill is a massive overhaul of the system that we know. It will not allow folks to enjoy the kind of health care that we have to this point, and frankly, it won't do anything to reduce cost.
Congressman Hoyer, I want to have you respond a little bit to Congressman Cantor's points, because there are members within your own party who have serious concerns about this bill. Some say it will cover illegal immigrants. Others say it will fund abortion. We're down to the wire now. What compromises have you all made on those two issues specifically?
It's not going to fund abortions. It's not going to fund illegal immigrants. And furthermore, Amy, let me point out, Mr. Cantor mentioned the recent elections. There were two congressional elections held on which federal issues and health care in particular were issues. In both of those districts, candidates won, two Democrats won, one in a district that had been held for a Republican by 100 years. And the issue was, should we have a health care reform bill like the one that's going to be on the floor today? And in both of those districts, the Democratic candidate pledged to vote for this bill, won. Now, that was just some 96 hours ago. Those two members who have just come from the electorate are going to be voting for health care reform for all Americans to give them the security they need and to bring costs down, which are unsustainable. And the CBO, of course, says our bills are paid for. The Republican alternative, which they will offer, frankly, is a bill which will result in there being more uninsured Americans 10 years from now than there are today. That's not what Americans voted for. That's not what they expect. And I think we're going to see the majority of the House of Representatives vote to pass this bill, send it to conference, so that we can get health care security for all Americans.
Congressman Cantor, both the American Medical Association and the AARP have endorsed this bill. You've downplayed those endorsements this week, but these are two very respected organizations. Don't those endorsements give this bill some credibility?
Amy, I think what we need to do is let's take into account the people that are watching your show this morning. These are moms and dads taking care of their family, having breakfast together. And what is it that this bill will do? What is it that our Republican plan will do? One bill on the Democrat side will put the government in between the families and their doctors. One bill won't. One bill will make it so that we have over $1 trillion worth of spending over the next 10 years and increase the deficit more than any that we have seen before. One bill will actually save money and will lower health care costs. The Congressional Budget Office says that the Republican plan is the only one that will actually reduce insurance premiums. And one bill will make sure that we take smart, reasoned approach to improving the system that we have. And the Democratic approach is basically let's overhaul the entire system and create an entirely new government program that folks are going to have to get used to. And I think that's really the perspective and the important point, which is why we're seeing seeing such a large bipartisan vote against this bill, there will not be a bipartisan vote for this bill.
Congressman Eric Cantor, we're out of time. Real quickly, Congressman Hoyer.
The AMA and ARP endorsed it because they think it's a good bill and do not believe the representations that Congressman Cantor just made.
All right, Congressman Steny Hoyer, Congressman Eric Cantor, thank you both for your time. We appreciate it.
Thank you.